First and foremost, I'm Trizza Banda from Malawi, one of the beneficiaries for Merck Foundation TMC Africa Oncology program. I was recommended by the First Lady of Malawi, Madam Monica Chakwera, to be taken for the training, and I was admitted at Dr. Bubaneswa Bolowa Cancer Institute on 14th June 2022. Malawi has indeed a challenge of human resource in terms of the oncology practitioners. Currently, we have only 3 certified oncology nurses, 5 oncologists, 4 pathologists, and only 2 radiologists. So you can see that there is a big burden in terms of human resource in Malawi. Compared to number of people, of patients who are registered each and every year in all the 3 referral hospitals. Despite having these challenges, but we have repeatedly demonstrated complex chemotherapy administration in those limited settings to our patients. However, there is still a challenge in terms of monitoring of toxicity, side effects of the chemotherapy, because these patients are supposed to come to the hospital frequently, but then due to lack of support for even home-based care nurses, palliative nurses, it's very difficult to follow up these patients and even for them to come to the hospital due to poverty and some financial constraints. So it's a very big challenge in Malawi about the oncology. And also, Malawi is still way behind in terms of this issue of oncology. It has just emerged as a threatening disease because most of the times, many African countries were not considering this cancer as a big, as something that is indeed taking a lot of people. But then in the emerging years, it has proved that cancer is becoming a very dangerous disease that is taking a lot of people with high mortality rate. So oncology in our country is still at infancy. That means we are still requiring a lot of specialists in oncology, including nurses as well as doctors. This training program is very important to me, my patients, as well as the country at large. As I've already said that in our country there is quite a very big gap between patient ratio as well as specialties of oncology. I mean healthcare workers who are specialized in oncology. So I feel like I'll reduce the gap when I go back to my country with the skills that I've attained through Merck Foundation oncology training. I feel like the gap that has been there will be reduced. I've gained a lot of expertise in terms of how to care for a patient who has been diagnosed with all types of cancers. So I feel like I'll benefit quite a number of patients, thereby reducing the gap that is there. And also issues related to chemotherapy, side effects will be well handled, and thereby reducing the high mortality rate that is there in the country for cancer disease as a non-communicable disease. Okay, during my admission at Dr. Bubaneswa Bolowa Cancer Institute, I've learned a lot of things in all departments, including chemotherapy. I've learned how to administer chemotherapy, how to manage the side effects that arise with different types of chemotherapy. how to handle a patient who is receiving chemotherapy, because as you know, these chemotherapy drugs are different from other drugs, so they need to be handled with caution and with seriousness. And I've also been exposed to gynecology department, whereby we were able to do the vaginal inspection, as well as doing the breast cancer assessment and screening, pap smear, and we have been to the fields where we were able to take samples from different kind of patients for research. And we have also been admitted to the pediatric unit, whereby we were able to see how they do monitor these patients who have been diagnosed with cancer and are on medications, and some who have reached their optimum level of chemotherapy administration, whereby monitoring them, and also how to diagnose these types of cancers. Also, we have been exposed to the bone marrow aspiration, as well as bone marrow biopsy sample taking, whereby we were able to see how they do and how they take these samples, and how they do monitor and assess the diagnostic criteria of different types of cancers, including leukemia. We have also been exposed to the pain and palliative unit. As you know, the oncology patients, they do meet a lot of symptoms and they suffer a lot in terms of pain. So palliative care is an important unit of oncology, whereby you're giving hope to these patients who are suffering from different kind of cancers. So we have ranked how they do and how they handle these patients in terms of managing the symptomatic issues that these patients with oncology who are on palliative care are handled. And we have been to the home areas where these patients are, whereby we're able to see how they care, and we have also cared patients in their home settings. I would like to thank Merck Foundation for providing me with this opportunity of a training in oncology. I feel greatly equipped through the training, and I feel like when I go back to Malawi, I will reduce the healthcare gap that is there in the specialty of oncology. Secondly, I want to thank the First Lady of Malawi, Madam Monica Chakwera, for recommending me towards the training as a Merck beneficiary student. Thirdly, I also want to thank the Institute of BBCI and the entire management for allowing me and my friends for the oncology training that we have had here in different departments. It has been a great exposure, and we've really learned quite a number of things. Thank you so much. Malawi, the warm heart of Africa.